This is the presentation of qualitative findings from the social media listening study in DLBCL from the US. 419 posts were analysed qualitatively, 3/4 of which were made by people with DLBCL, and the remainder caregivers or family members of someone with DLBCL. Most posts came from forums or from Instagram. This section looks at what happens to the patient from initial symptoms to diagnosis, and in line with the war and battle speak mentioned in the previous section, we've called this the preparatory phase. So initially, symptoms can be very non-specific, very disparate, particularly the B symptoms. They could represent anything. And it's not unusual, therefore, for the patient to sit with symptoms and do nothing initially, unless the symptoms are very severe or a mass or a node becomes enlarged overnight. And then they will react immediately. But patients may well sit on symptoms for a number of months, as it says here in this quotation, until they see a physician. Pain was mentioned by those posting in a whole range of sites, but most commonly it was the lymph node sites of the neck and the GI tract. When the patient does present to a physician, again, a delay can occur. Generally speaking, patients didn't report a particularly unusual delay in the diagnosis of DLBCL, though a number did comment that they had been initially misdiagnosed and their symptoms put down to a lung infection, bronchitis, or muscular pain. And they may have had diagnostic tests, they might have blood tests, they may have had imaging, but the DLBCL wasn't picked up or noticed at that time. And in those cases, it was either the patient or the caregiver's persistence that meant DLBCL was finally recognised, or that their situation deteriorated and it became more urgent. The site at which they present varies according to the severity of those symptoms. So if things are particularly severe, they've got extreme breathing difficulties, for example, or they're in extreme pain, then they would present to ER. And I should mention that it was no less likely that they would be misdiagnosed in ER as with the GP. That misdiagnosis also happened in the ER. Milder symptoms, unsurprisingly, they took to the GP. Specialists were not particularly consulted initially. It was more likely to occur once someone became fed up with the GP's attitude towards their symptoms, that they may then seek more specialist advice if they didn't feel the GP was taking things seriously. And here we have a quote from someone who talking about his girlfriend and how it took a long time for the DLBCL to be spotted. And initially she was taking inhaler and steroids to treat what was said to be chronic bronchitis. Patients and caregivers describe diagnosis as stepwise, culminating in the staging and final chromosome analysis to identify the specific subtype of DLBCL. The final stage of chromosome analysis gives rise to a long wait for patients and their families to fully understand with what they're dealing. And in some respects, they felt that waiting for that final information on them, which subset of DLBCL they had, was in fact more anxiety-provoking in some respects than the original diagnosis of lymphoma. But again, adding to the time taken for final diagnosis, the process itself was seen to be very stepwise, very logical. So it started with a fine needle biopsy, perhaps, depending on the location, obviously, of the initial DLBCL presentation. That was often not inadequate. Then they had to move to the incisional biopsy. They might have an MRI, and it was a very gradual process moving finally towards the staging. And even having got a diagnosis at the end, a small number believe that their final diagnosis was in the end uncertain, either because they felt different doctors that they'd seen drew different conclusions about what the pathology report suggested, or indeed the pathology report itself was inconclusive. And therefore they had to go forward with the anxiety that they were not perhaps receiving the best treatment for their particular variety of DLBCL. This waiting, so they're sitting on symptoms initially by some, the physician's inability to spot the DLBCL initially, and then this slow process towards diagnosis meant that in those that were posting in our sample, over half were actually stage 4 when it was diagnosed. So unsurprisingly, emotions at the time of diagnosis are predominantly negative. Where some positivity was expressed, it tended to be that the subtype of DLBCL wasn't one of the more aggressive ones, or that the disease itself wasn't very advanced. And there was some relief that they finally knew what was wrong with them, having lived with particularly burdensome B symptoms. They were relieved to find that there was a reason for how they were feeling. But by and large, negativity, unsurprisingly, prevailed. So there was fear and anxiety, obviously fear that they may die from the DLBCL, or that the slow diagnosis might have mean they're more likely to succumb to DLBCL. Anxiety and worry centred on their preconceptions about chemotherapy, that the chemotherapy itself might be the thing that killed them. There were anxiety as well, particularly amongst caregivers, that treatments may not be covered by insurance. And so there was a wait, for example, to know whether CAR T cell therapy would be covered. And that was an additional worry for some. In some respects, patients and caregivers felt initially like as if they were in a void, because they were uncertain of that final diagnosis. They were waiting to more clearly understand what was happening to them, what would happen to them, and still waiting for that final confirmation of diagnosis. And so it was at this point as well that they were looking outwards, looking online for reassurance, to be soothed by the answers of others. Patients and caregivers also wrote about the shock of the diagnosis, that they were crushed by learning that their loved one or that they had DLBCL. Especially, this can be particularly shocking if they'd had very benign symptoms, very everyday symptoms, and as it turns out, they actually had lymphoma. In a minority, that shock led to denial, that they refused to accept that their symptoms could possibly equate to DLBCL, and surely the doctor had made a mistake along the way. For some, there was that first response was sadness, as they took a lymphoma diagnosis to mean that they'd missed their children growing up, they'd missed graduations, they'd missed their wedding, or that they'd be leaving their partner alone in the world. And for some, that led on to depression, a sense of being depressed. Others were deeply distressed at the unfairness that they or that their loved one had got DLBCL. They'd previously lived a perfectly healthy lifestyle. One, for example, wrote that they'd studiously avoided carcinogens in their life, and here they were with DLBCL. The unfairness of leaving their young children, or some talked of poignancy of it being Christmas, and how unfair was it to learn that their wife was sick at Christmas. That unfairness obviously bled sometimes into anger. Why me? Anger towards that physician that had not recognised the DLBCL up front. And there was some anger also expressed towards the people around them and their response to the diagnosis, that they didn't know how to deal with someone with cancer, or that their empty words provoked anger in the patient. As mentioned, the road to diagnosis was long for many that posted, and that involved often numerous hospital visits and appointments. And so by the time a diagnosis was given, they were felt exhausted and overwhelmed by the process that they were involved in. And the quotation here from someone, "Oh, my oh so beautiful heart is shattered into a billion pieces. I sunk my bottom into the overwashed, ill-fitting hospital bed sheets and put my head down. Teardrops marks have already fallen from my face onto my gown. My whole life felt it had been ripped out from beneath my feet in a matter of minutes."